Welcome to Anatomy DAHAR series. Today's topic is Histology of the Tongue. Illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Histology of the tongue. This is the sagittal sections of the head and neck. This is oral cavity. This is oral pharynx behind the oral cavity, which is the middle part of the pharynx. This is the tongue inside the oral cavity. The tongue is a mobile striated muscular organ covered by mucosa. It can assume a variety of shapes and positions. It is also called lingua in Latin and glossa in Greek. The tongue is partly in the oral cavity and partly in the oral pharynx. The functions of the tongue include detect the sensations of the taste, the articulations of words during speaking, being involved in mastication, chewing, squeezing food into the oral pharynx, and oral cleaning. Parts of the tongue. This is the sagittal sections of the oral cavity and the tongue. The tongue consists of a root, tip, that is the apex, and the body in between the two. The root of the tongue is postero-inferior immobile part. It is fixed to the mandible in front and the hyoid bone below and behind. The tip, that is the apex, is a free anterior end that comes into contact with the back of the central incisor teeth. The body is a mass of skeletal muscle covered by mucous membrane and stratified squamous non-keratinized epithelium. The tip and body of the tongue are extremely mobile. Surfaces of the tongue. The diagram is showing the superior surface of the tongue. This is the tip in front. This will be the root behind. The tongue features two surfaces, superior, also called dorsal, and inferior, also called undersurfaces. The superior dorsal surface is convex on all sides, that is anteroposteriorly also convex and side to side also convex. It is characterized by a V-shaped groove called sulcus terminalis. The apex of the V is directed posterior to a small pit called the foramen cecum, the remnant of the proximal end of the embryonic thyroglossal duct, which developed into the thyroid gland. The limbs of the sulcus terminalis extend lateral and anterior to the insertions of the palatoglossal fold at the side of the tongue. This is the diagram of superior, that's the dorsal surface of the tongue. This is the tip of the tongue. This is the root of the tongue. The superior surface of the tongue is divided by sulcus terminalis, which divides the superior surface into anterior 2/3 pre-sulcal area and posterior 1/3 post-sulcal area. Anterior 2/3 is located in the oral cavity and posterior 1/3 is located in the oral pharynx. Just anterior to the sulcus terminalis, that is in pre-sulcal area, there are up to 12 valid papillae located. See papillae slides later. The oral and pharyngeal parts of the tongue differ in their development, topography, structures, and functions. This is the diagram of superior surface of the tongue. The mucous membrane differs conspicuously on the two parts of the tongue. Anterior 2/3 of the tongue is located in the oral cavity, and its dorsal surface is covered with papillae and is velvety. This surface shows a shallow median furrow that divides the tongue into right and left halves. This is the posterior one-third of the tongue located in the oral pharynx. It is studded with rounded elevations rich in lymphoid tissues, present deep to the epithelium. They are collectively called lingual tonsils, part of the Walde's lymphatic rings. Papillae. The dorsal surface of the anterior two-thirds of the tongue has lingual papillae. They are projections of lamina propria of mucous membrane covered with epithelium. There are four main types of lingual papillae: filiform papillae, fungiform papillae, velate papillae, and foliate papillae. This is number 1, filiform papillae. Small conical projections and most numerous type. They are pinkish gray and are arranged parallel to the lateral limbs of the sulcus terminalis and are responsible for their velvety appearance. The tips are covered by stratified squamous keratinized epithelium. They are sensitive to touch but do not bear taste bud. So, dorsum of the tongue is stratified squamous epithelium, non-keratinized. However, tip of this filiform papillae is the keratinized epithelium. Second is fungiform papillae. Mushroom-shaped, consists of narrow pedicle at the base and a long red rounded head, scattered singly among the filiform papillae near the tip and margins of the tongue. Each bears some taste buds. The third type of papillae are velate papillae, formerly known as circumvallate papilla. It is circular in shape. Look here, circular in shape. The largest among papillae, about 1 to 2 mm in diameter, up to 12 in number, arranged in V-shaped row just anterior to the sulcus terminalis. We have already mentioned them. Each papilla is truncated, that is inverted cone shape, with a narrow base and broad flat top, surrounded by a circular sulcus or moat, which is about 2 to 3 mm deep and is bounded on its peripheral by lateral wall called velum. The duct of serous glands open into the sulcus, and many taste buds are found on both walls of the sulcus, that is on the lateral wall, velum, and on the velate papillae you will see many taste buds. The fourth type of papillae are foliate papillae. They are small and very poorly developed in humans. Taste buds. This is a diagram of the taste buds. Taste buds are found in two types of papillae, fungiform and velate papillae of the tongue. However, they can be found also in the soft palate, epiglottis, palatoglossal arches, and posterior wall of the oral pharynx. They are piriform, that is pear-shaped structures, extends through the entire thickness of the stratified lingual epithelium. It is made up of modified columnar cells arranged perpendicularly to the surface. You see, perpendicularly arranged to the surface these cells are. Each bud is a small cavity that opens to the surface through a gustatory taste pore. Three types of cell can be identified in the taste bud. Number one, sustendicular, that is the supporting cells. Darker cytoplasm with slender dark nucleus. Second type is gustatory taste cells. Lighter cytoplasm and more oval nucleus. The third type is basal cells, located near the basement membranes. Sustendicular and gustatory cells are spindle in shape. You can see spindle shaped. Their apical surfaces have long microvilli that protrude through the taste pore. Histological appearance of the tongue. This is the sagittal sections of the tongue, microscopic appearance. Deep to the mucous membrane and the papillae of the tongue are connective tissue, consists of mucus and serous glands, adipose tissue, intrinsic striated muscles, vessels, and nerves. These are the papillae, and this is the mucus secreting glands. This is the serous secreting glands. These are the striated muscles, intrinsic muscles. This is the adipose tissue, plus blood vessels and nerves will be present in the slides. Numerous mucus and serous glands are present in the connective tissue deep to the epithelium of the tongue. Mucus is more in the posterior third. They open into the recesses of lymphoid tissue. Histological appearance of the tongue continuation. The serous glands are present mainly with the velate papillae and open into the grooves around the velate papillae. Secretions of these glands dissolve the substance to be tasted and spread it over the taste buds and wash it away after it has been tasted. The biggest glands in the tongue are present in the ventral aspect of the tip. They contain both mucus and serous acini and are called anterior lingual glands. In addition to all these structures, the main contents of the tongue is intrinsic muscles of the tongue. They are striated muscles directed various directions, longitudinally, vertically, transversely, and obliquely. The end, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.